More time on the ground than I want.
Is it all near where the wildebeest live?
Yes.
You guys can say, when are they in office?
So, December, they said it's about time to review it.
That's what it is. I forget to know. This happened. I should go get a blue shirt. You'll listen tomorrow. It's in July, August. Time period. And I would have.
Come to our side.
Gone down, take it.
Yeah. Hi, how are you? Good.
Come back to, right?
How was your presentation? I'm sorry, I missed it. It was right in the middle of. Yes, good.
Yeah, I thought.
Yeah. Was it recorded? They went web?
If it was, I wasn't.
We need to.
I don't think it was. That's okay.
I know, I.
It was just.
Oh, yeah.
Just a little bit of.
Yeah. It's a good time. There's a lot of like humanitarian heading that way.
Kind of nice.
Yeah, yeah, but they said, the reporter said.
I was actually.
Must really miss it today. So it's like, wow, I'm going to do that.
I don't know, they're children, you know what I'm saying? So, yes, everything's true.
For work.
Well, you have to have government willing to invest in the areas that could do.
Wow.
I'll do exactly what they're not gonna do.
Yeah.
All right, 4:30. We'll call the meeting to order. Hi, Michelle. Hi, Ellen. Hadn't said hello yet to you guys. So we'll call the meeting to order and adopt this agenda. It is recommended the Board of Health members adopt the agenda for the November 16, 2022 meeting. May I have a motion?
So moved.
A second?
I will second that.
Any discussion? Hearing none. All those in favor say aye.
Aye.
All those opposed? We have adopted the agenda. Approval of the minutes. It's recommended that the Board of Health members approve the minutes of October 19, 2022. May I have a motion?
I would so move.
Second? Second. Any discussion? Hearing none. All those in favor say aye.
Aye.
Any opposed, say nay. The ayes have it. We have approved those meeting minutes. Board president announcements. I just had one. I participated in a fantastic meeting this morning with Department of Health employees as well as folks from Notre Dame, Beacon, the city of South Bend, community investment. There were a number of partners around the room, once again, talking about lead poisoning prevention. And with the recent drop in case management guidelines and so forth, there's a ton of work to do. But Notre Dame has a new small grant for planning. So this very large group got together for the first meeting to decide how we want to use those dollars and how we're going to apply for future funds. And so I just wanted to give a shout out because I was energized by the meeting and the generation of ideas that was coming out of it. So it was awesome. So moving on to agenda item number 5, I turn this over to Dr. Bob.
Yeah, thanks, Heidi. You should all have received the health officer's report. It will not surprise you that I really don't have much to comment on. I will simply note that COVID and monkeypox unfortunately continue to simmer within our county. We are seeing a few more travelers from Ebola, from Uganda, whom we are following for Ebola, to look for Ebola. It, of course, has not been in this country yet. We hope it isn't. And then the other thing that I would simply comment on is some of the work that Mark Espic has been doing. He made note of it in his report, but he's been working hard with the city and EPA and others to try to clean up the South Bend, the old South Bend Range facility that had some chemicals left there that needed to go elsewhere. So Mark can speak more about that if you're interested, but it's been nice work on his part. Other than that, it's pretty much status quo, and I'd be happy to answer any questions that you might have.
Yeah, let's open up to board for questions.
Looks like we had a big month of vaccinations in October. Really sort of outpacing what you might predict for that year compared to even the last couple of years, where we were giving a lot of non-influenza vaccines at this time too. You know, we expect that to continue to spike into November, or was this a shifting of people who might have previously vaccinated in November, getting them a little bit earlier this year? Thoughts about that?
I think there may be a couple of things going on here. First, we're a little bit better staffed. We're still not yet fully staffed within immunizations. But we're better staffed than what we had been. And so that I think has been contributing. And it's a little bit difficult for me to know whether it is a shift from earlier or from later to earlier. But the nursing staff have been quite busy up in the immunization clinics. So we're not yet fully open in Mishawaka, but we're moving in the right direction. The mobile team has continued its efforts as well, so that may be contributing a little bit here as well, compared to certainly 2019.
Do the state mobile clinics, the state health department clinics they run, does that go on these numbers if they're in St. Joe County?
These are just ours. These are just our Department of Health numbers.
So looking at the chart on page 46, total immunizations excluding COVID immunizations. So it looks like you're kind of back to kind of the pre-pandemic standard. You know, how here year to date 2022 is about a little bit more than 2019.
Mhm.
So you're kind of back to
I think
kind of back to normal. Way
think-
to,
in terms of the number of immunizations that we're giving, where the non-COVID immunizations are approaching what we had in 2019.
yeah.
Exactly. And so that's what we're saying.
Okay.
I think that those, again, when we get fully staffed, we'll exceed those numbers, but we're just not fully staffed.
I think this is just a clarification question, but at the bottom of the page where they're talking about the mobile unit and helped cover the South Bend Immunization Clinic. The COVID clinic was very busy with giving flu shots. I guess I just want clarity. When you're saying COVID clinic, what is that referring to specifically?
So what we have, Ellen, there's up in the 9th floor, we have what we'd call the routine immunization clinic, where the children come for their immunizations. Adults come for travel immunizations, and we can give flu vaccine there as well. And then on the south side of the building, on the floor, that's the COVID clinic that's open Tuesday, Thursday, Saturday. And in the COVID clinic, they only give a COVID vaccine and influenza vaccine. And then, so that's the COVID clinic.
Okay, so you're just also offering flu shots in that space?
Yeah, we're offering flu vaccine.
Okay, okay. All right. And I'm curious, the high schools where you hosted the clinics, is it just, is it all the high schools in the county? Is it just the public high schools, private, whoever asked for you to come in? Kind of how does that work?
We will reach out to anyone who expresses interest in our, gosh, I don't lose my ball there.
Get that back over here.
It's really close. I'll use my hand instead of between my legs. we'll reach out to anybody who's really interested in doing that with us. Our mobile team works with virtually any school system that expresses interest. We really focus on, I've been trying to focus on the South Bend community school systems, the schools within the South Bend School Corporation, given that their immunization rates tend to be significantly lower than say PHM. But Mark's got more experience in this than I do. Mark, do you want to comment on that?
Yeah, I would say, beginning pre-COVID, we had been paying attention to the low rates of immunization compliance reported in various schools, and so reached out deliberately to the biggest school districts, but South Bend School Corporation probably has been the most actively engaged, and then specifically with the creation of the empowerment zone, trying to collaborate with them. And we revisited that this year and tried to reframe and work with school districts to identify kids that were out of compliance. Because South Bend schools this year really took a stance for excluding kids who were not in compliance with immunization requirements. In the past, they have kind of paid it lip service, but this year they put a little more teeth to it. And so we worked to provide access to services on site through the mobile clinic and access through the big site clinics to ensure that it's access immunization services.
Okay.
But it's been a lot of Herculean effort on Shelley and Abby and the mobile team's part. But the yield has frankly been still somewhat disappointing. But I think that since this is the first time they've actually excluded kids, that's one of those things that the legend will live on. And so next year parents will take it more seriously because they excluded this year. And so as parents get habituated to that, then they'll be more proactive in meeting their requirements.
Okay.
What I don't know, Alan, is if the parochial schools are more stringent in their requirements or in their enforcement of the requirements. The requirements are there. It's a question of are the principals of the respective schools willing to put enforce it or not. My guess is the parochial schools are probably have a little bit more freedom to enforce these rules.
Now, typically, does kids who are excluded in South Bend schools, that wouldn't include kids with like religious or medical exemption,
Correct.
correct?
They have to have a thank you, permission. That's what I was looking for.
Okay.
Yeah.
So how does it work? Are they told like if they don't have their vaccines up to date, they're told, well, you could get you either have to get the vaccine or you're eligible for this exception, unless you're eligible and claim this exception. Is that kind of how it works?
Yep.
Okay. Okay.
I personally would wish that it would be more forceful, but given that the track record has not been very good.
But were you, I can't recall if we discussed this at the meeting prior, you were looking to hopefully create like a single point of contact for the South Bend schools for that
Yes.
particular issue?
So we've been in discussions, in fact, most recently, just 2 nights ago, was it yesterday? Mark and I and Brandon White and Todd Cummings had a meeting to discuss how we might move forward in a more productive and effective manner. So we're thinking of looking at a number of different options in that
So
discussion.
but leadership recognizes obviously that there's a problem here, and so they want to work with us to be able to move that along. Well,
And I'm very sympathetic as well to their concerns. Obviously, none of us want the kids out of school even that day. And so there's a bit of a fine line to how strongly one needs to enforce these, but the track record is not very good. And I think personally think it's time for a more stringent enforcement. And the enforcement isn't, you have to have your vaccine. It's you need to be scheduled for your vaccine. So if you're, as long as they can show they've been scheduled and, be scheduled 3 months out, but as long as they can show that they've been scheduled for the vaccine to see Dr. Migliori or whoever.
Right. Or if the parent is going to opt out, then let's have that documented
Right,
as
and that's-
well.
that's-
That way, then everybody is
The
accounted
vast majority-
for.
This isn't really vaccine hesitancy or religious exemptions or religious objections. This is really, like all the rest of us, inertia and
Just to get it done.
getting over the inertia.
I had a question about the Women's Care Center. There were 2 charts and maybe those charts were in there the last time and I didn't remember, whatever. But I was kind of curious about a percentage of clients receiving insurance assistance. Is this for setting up new insurance? Or is it that they have insurance but need assistance with identifying a primary care doctor?
It can be.
It can be any of
It can
the
be
above.
both. So, yeah.
Wow, so 86% of the folks needed some sort of
that month.
assistance, right, for that month, they needed that assistance.
Page 37.
I'm on 38,
Ah,
38, yep. And then the chart right below it says percentage of social need requests by month. And there's 111 folks in there. What are the takeaways there? Like what is that telling you? Like transportation being 0%, I was just like, wow, because usually that's a barrier to care is transportation, and here it's appearing as 0%. So I'm just kind of curious how you guys are interpreting that chart and what you might do differently as a result of that data.
Yeah.
The biggest takeaway here is that individuals who are women who are pregnant are not connected to antenatal care. And so when they go to the Women's Care Center, Women's Care Center doesn't provide prenatal care, it really provides pregnancy diagnostic care. So it's very important that individuals who go there get connected to antenatal care, because early antenatal care has been shown to decrease maternal and infant mortality. And when it is delayed, obviously infant and maternal mortality will rise. And so a lot of the work that our community health workers have been doing is trying to connect the women who are being evaluated and served by the Women's Care Center to an antenatal provider, prenatal provider, so they get them en route to care.
Do we know what that time span is from like identifying that somebody does need prenatal care to when they actually get prenatal care?
We're working on tracking that more, but I would say it's improved each month because with Sally and the femur case review, our CHWs are getting connected to providers quicker. And so they're getting connected to people within those offices where they can make a direct referral and they have relationships within those offices. And so I would say overall, we're seeing an improvement based on what we're hearing from our CHWs, that they're able to get women into care sooner.
I think the benefit is they can make that call, who to ask for, say, and especially if somebody has a history of a pregnancy complication, they can say, that, they had preterm delivery last time, and that'll help expedite.
Yeah, no doubt.
Because it's hard, like most people don't know to say those things themselves when they
Right.
call, so it's great to have that kind of support just to make the appointment. Not only making a referral, when your own doctor makes a referral to a specialist, you get in quicker.
Definitely. Any other thoughts, if I might ask the directors of the grant that oversees this, any other thoughts about how you interpret that data or anything else that it tells you or tells us?
Surprising. I don't think
Okay.
that's, insured, because insurance can be a delay. If you don't have insurance and you're pregnant, and that can be a delay in and of itself to getting into the doctor, because the whole Medicaid application process can take an hour, a month to go through all the aspects of that. So having somebody walk through that with you, we can do presumptive eligibility, which gets insurance like that, like immediately, and then you have a month to finish the process. That then helps insurance,
Right.
you know, go, so.
And I think we'll see some changes over the months, because even for November so far, our requests for utilities has gone up quite a bit. So I think going into the winter months, we'll see an increase and
Okay.
assistance for that as well.
Are you having difficulty with a list of providers that will either accept non-insured or Medicaid? You know, some providers like, we don't take Medicaid, or, you know, we don't.
I think,
Are you having trouble finding people to refer to?
I think because
Well, the specific forms of Medicaid, so like Care Source is really, really tricky to find a provider who will accept that.
I was gonna say,
specific.
they're getting, they are, Kathy and Christina are really good at knowing now who accepts what, but yeah, CareSource doesn't have a very broad panel here. So for anyone who doesn't know, there's 4 different managed care companies that manage Medicaid. So somebody might know they have Medicaid, but not realize, oh, I have CareSource versus Anthem versus NHS, and not every doctor's office, it's, as you know, takes every one of those. So it's very complicated.
So I guess I asked just for clarification, because I mean, when I look at the large number of women who need OB prenatal care, well, it seems like self-evident because they're going in for pregnancy tests, and if they don't have an OB or, you know, OBGYN, obviously, and they get a pregnancy test and it's positive, well, then they need prenatal care. And that's a new need. So I guess, is this indicative of are people, I mean, it seems like this is always going to be a standard issue that at the Women's Care Center, that's going to be the need that they most need to assist with, additional need, or that you need to assist with. Is it just, but what you're saying is that the amount of time between that initial visit and when they're actually seeing an obstetrician for the first time is getting smaller.
Oh,
Is that,
yeah, I mean,
okay.
that's the experience when they're working with a
Yeah,
community health worker, yes.
yeah, okay.
And these numbers only represent who our community health workers see at the Women's Care Center.
Okay.
It's not representative of
Mhm.
all people who go to Women's Care Center.
Okay,
It's just when a counselor makes a referral to our CHW.
okay. What type of, what's kind of the standard demographic of a woman who is being referred to a CHW? I mean, is it like the college student from Notre Dame who's coming in? Is it the, you know, woman?
We don't
from the
have
West
that
Side or-
Data
Okay,
from
it's just,
Women's Care Center.
they're kind of figuring out on their own.
It's more based on needs. So if a counselor is having a conversation with a individual who is saying that they've had previous pregnancy complications, that's going to be a main indicator to provide that referral over, but also the other social needs. So insurance, food, utilities, housing, transportation.
Okay.
If they're during the counselor's conversation with that person, they will then make a referral. But it also varies from each of the Women's Care Center locations.
Sort of at their discretion.
Yeah.
Who they,
Okay, and which locations are the CHWs
All
working at?
four.
So are they, there are 2,
Yeah, so
right?
they
So they do just
travel
kind of
around.
travel
they
around.
make appointments, you know, if the counselors are seeing someone, they'll, you know, have that discussion and then make appointments.
Oh,
to
okay.
come. Yeah.
So they're
And
kind of
sometimes-
going as they need. It's not like
I think
you're
they're
at
scheduled certain.
here one day, here another day.
They
That's
are,
kind of how it
yeah.
works.
Oh,
So
okay.
we have one that's at the Mishawaka location and the Lincoln Way West location.
Okay.
So 2 days a week and then one day that's kind of floating or utilized for documentation. Then the other CHW is at the Notre Dame Avenue.
And then if they happen to be there and someone comes in that needs help, you know, they can
Okay.
take them then too.
And the referral wouldn't necessarily have to be to an obstetrician, it could be to a family medicine doctor
Mhm.
who is
Right.
providing antenatal care.
Sometimes they know who they want to see.
Do we have other questions about the health officer's report?
You know, I'm very curious. I think I've been meaning to ask this for months, and I don't think I did. Though I think a few months ago, somebody else did about the animal bites. Why are they so much higher this year?
Yeah, I had that same question.
Okay, so it's nobody still, you still have no idea.
Yeah, we have no idea. In fact, it even, queried that of Jody, we're all responsible for that. And we don't know. We don't know. It seems awfully high, but the animals are more aggressive.
I guess I'm curious about the same thing, whether it's a particular region of our community, whether it's a particular animal group as
In
opposed to.
fact,
Is it,
I just,
is it some doctor's office, it's just all
It's
about.
kinda cool.
animal life?
It really- you would think that we planted, Ellen, to have this question, because we have the response to this right here, but I was curious as well. It's like, from a 1/1 to 2022 to 11/16/2022, there were, I'm looking at, look like 168, if I'm reading this correctly, in South Bend, 149 in Mishawaka, 138 in the county as a whole, outside of those. And it looks like it's 319 dogs, 106 cats, 42 bats, 9 others. And yeah,
This screams out for an epidemiology intern to really dig in.
it really begs the question. You know,
That's my hypothesis. It's pandemic dogs. Everybody got dogs during the pandemic. Yeah,
well, I was gonna say, it begs the question.
it is a lot of cats.
Maybe a lot of people should be.
I know, right?
Yeah.
Half the bites are in Mishawaka and they have a fraction of the population.
Very curious.
Yeah, they're very curious.
Am I correct that we've got a pretty light agenda?
We do.
We could spend a few minutes. Mark, I'd love to hear about what you're doing down there. I didn't read it in the report. I didn't see it there. Maybe I missed it with regard to the helping to clean up the.
Yeah, so back in July, we received information from county council about properties out on the west side. Hurwich Iron, they were concerned about, and then there's some vacant land out front that they wanted to develop. But then looking into it, discovered the South Bend Range, which is behind the 3 vacant lots. And it needed to be addressed. It looked like from the aerial views, more of a problem than the Hurwich Iron site. I went out, so I just told him I'll try to find a hole in the fence, and we did. And then Dr. Bob and I, along with the police escort, went into.
Took our lives, you know,
And
on the line.
there were quite a few drums, but we didn't see everything. But there was enough for me I called a colleague down at IDEM and told him everything, sent him pictures. He immediately contacted EPA. So then I took EPA through the site. They scored it. It wasn't considered an emergency, but it was a time critical removal. And then I think it was about 2 weeks ago, they called me on a Friday, said, we'll be there Monday
Wow.
with the crew and we're gonna start getting these drums out. So everything happened really quick from July to now. And so they went in, and then those 3 days, they were able to get the drums out of the building. We've got them all staged. There's a total of 65 55-gallon drums. Probably the worst stuff is the isocyanate. There's muriatic acid. There's some boiler chemicals like potassium hydroxide. There's some stuff we don't know what it was, but the pH was 14, so it's about as high as you can get. And so we've got them all staged, and then the week of December 12th, EPA will be back into town to sample everything, get a waste determination done on them. And then after the new year, they'll start pulling drums out of there.
Now, correct me if I'm wrong, the other good news is that EPA also said,
Yeah, so it was kind of, so we were having a wrap-up meeting with the mayor and some of the council members, and so I let everybody know, because I called my contact at EPA to thank him for all the quick work and how great everything went. And he just said, Mark, if you really want to thank me, find me another building to clean up. So here we have the federal government asking us for work to do. So the mayor knows it, everybody the elected officials know it. So now we're searching for other buildings with the orphan or abandoned drums to get them cleaned up.
Mark, what was South Bend Range? What is that? What business is that?
They made ovens.
Yeah.
So-
they-
Oh, the range.
They were.
Oh.
They
They're
were
still in
high
business.
quality.
Oh,
They've left, I think they're down in South Carolina, North Carolina. But it's South Bend is one word now, but it's still, they're still in business, but you know, they sold out, they left legitimately, they didn't really abandon the place, they sold off to another company and you know, that's where the mess happened, most likely.
Wow.
But yeah, right now, the South Bend Range, they're the leading manufacturer of commercial ovens, you know, for restaurant use and so on. But they're the Cadillac of ovens.
oh,
So how long were these chemicals sitting there and do you have, did you have leaks? Was
Oh, yeah.
there a lot of contamination of the
So
ground?
South Bend Range left about 40 years ago.
So it's been 40 years?
Yeah.
Well,
Well, but there's been other operators.
Oh,
Operators, yeah,
But
it's not
but
something.
one was like they manufactured lawnmowers.
okay.
So they didn't use potassium hydroxide or isocyanate. So, you know, those chemicals some of the chemicals have been there quite a while. Yeah, so there were a lot of leaking drums. Some drums were so deteriorated, they couldn't move them at all. They had to hand dip all the waste out into other drums before they could even do anything with it. And part of the problem was most of this, right now, if you look at it on an aerial, it looks like it's outside. It was actually all under roof. The roof collapsed in 2010. So there was a lot of bricks and debris that you just had to climb over initially, just, you know, to assess the site. So they spent a good day out there just with heavy equipment, moving everything out of the way to create paths in order to get the drums out.
Wow. Is there any more long-term cleanup planned after
Yeah.
this?
So the next step was, once we get all the containers out of there, MACOG has some grant money through EPA. They'll do a subsurface investigation. I've identified a couple areas where, you know, we had some pretty bad leaks. And so we'll just do some core sampling through the concrete and test that. You know, the ultimate goal is you know, they're looking to put in some low-income housing out there in the 3 vacant lots, but we got to get all this stuff cleaned up and taken care of first.
Okay,
So I think once the sampling is completed, the city will try to take over the property. If a guy bought it on tax sale, but I took him through it and then he decided he didn't want it anymore. And so he let it go back. The previous owner owed $362,000 in back taxes. So I think eventually the city's just gonna take the property over and then we'll knock the buildings down. Do it that way. But yeah, I've, you know, worked in this line of work for quite a while, you know, with IDIM and everything. I've never seen EPA move this fast or even just offer to come into town and do more work. So
so do you have more work for them?
we're working on it. I've been in contact with a couple fire inspectors. They're looking into, you know, some of the previous abandoned buildings where they've gone in on fires and they're checking through the records to see if they have an inventory of any containers or anything on site. So, you know, part of the issue is a lot of these abandoned buildings also have homeless and, you know, there's always those issues to deal with. But we'll get through it. We got a good team together now, working with the MACOG and some of the elected officials, I think. And, you know, and the fire inspectors, now that we've got everybody together and EPA behind us, you know, we can really knock some of these out.
Oh, it's really good news. Thanks, Mark. It's awesome.
Good job.
Yeah, absolutely. Anything else on the health officer's report?
I'll just comment on the media. Putting all those in there was great. Putting all those links in there.
That was rough. Where is?
She thought it was great.
Thank you.
We have a super, I just want to say a super light agenda, as most people probably realize. Just going forward for new business, usually that's generated, something comes up and then we add new business and that's how those things get added. We didn't have anything like that this past month, so this is why there's no new business. And at the same time, if board members have something that of interest that's related obviously to the Board of Health or the Department of Health business, those are things that can be added as well. But at this time, we don't have any new business and we don't have any old business. So we go to agenda item number 8, which is board notifications, where we hired a nurse, Ashley Hellman, who I believe she had worked for us before. Is that right? Yes.
Correct.
So welcome back to Ashley. And then we had a resignation, Daniel Wilson, who was a food inspector, and he resigned on October 10. No retirements or terminations. And so now it's time for public comment. So public comment, I have to read something here. At regular meetings, the public is invited to address the board for 3 minutes regarding items posted or not posted on the agenda. Individuals may only speak once during this section of the agenda. Speakers shall properly identify themselves by stating their name and address for the record. Personnel issues are not to be addressed during open sessions of the Board of Health. Board president may interrupt, warn, or terminate any person's statement if it should become personally directed, abusive, obscene, or inflammatory. So I will turn to Jenny.
We have Michael.
And go ahead, Michael, you have 3 minutes.
Okay, my name is Michael Friedland. I live at 226 North Jacob Street. I'm the rabbi at Sinai Synagogue, and I'm also on the core executive team at Faith in Indiana. It's the first time I'm at this meeting. I hope I'll be here more often because I think this is really important, the work that you do. And really, I'm just here today to say thank you. Faith in Indiana has been very active in support of the Mental Health Crisis Center. This is an issue that affects all of us. It doesn't care about your faith, your religion, your race, your partisanship. We're very grateful that the county and the city have been pledged money. And we're looking, our next plan is to make sure it's sustainable. So we're very grateful to this board for being supportive and to Dr. Bob for being involved with us, working with us. Also, I know that we still have COVID in our region, and we have it all over, but that I think this pandemic is somewhat over, if not over. President said it was over. But I'm just very grateful to this board for being so strong. And with the mask policy, I mean, thousands of lives were saved because you guys stood up and took a strong policy. So we're very, very grateful for that. And lastly, just as a leader in the Jewish community, we are watching very carefully as the state and the courts talk about the women's reproductive health in this country and in our state. This is a big issue for the Jewish community because we don't have the same religious approach to abortion that other faiths have. And since we live in a state where there's freedom of Religious Freedom Act, we're just hoping that act is consistent to all faiths, not just to certain faiths, and take their concerns. So that's what I wanted to say. Thank you.
Thank you so much. Thank you. Jenny, go ahead.
Ken Smith.
Ken?
Hi, my name's Ken Smith. I live at 536 South Sunnyside in South Bend. And I want to second Michael's thank you and also his comment about Freedom of Religion Act applying to people of all faiths in our state and in our community. And thank you for saying that. I wanted to say very quickly, with the long run of increase in gerrymandering in our state, increasing the politicization of many aspects of our civic life. And as I've kind of come to understand more recently, the narrowing of the perspectives among those who will appoint this board going forward, if I'm correct about that. The risk of politicization of the work of the health department seems risky that it might be increased. And so I want to urge the board to do everything it can to protect the team members of the Department of Health so that they can pay attention to environmental science and health science and education and policy and all of those things. The group that talked about the Women's Resource Center, Care Center, I forget the exact name, very informative, thank you. One of you mentioned that women don't always know what to say or ask, and I wonder if there is a good guide somewhere for pregnancy to say, at this point, these are some questions you should be asking. you should be learning about this, and you should be learning about this, and you might, anyway. Like how to decrease the risk of C-section, all the questions. Is there a guide? And I hope that the question, I mean, this is a question, I'm very impressed with the do you feel safe in your home question that medical people are increasingly asking in their practices. And I hope that the board does everything it can to make that a universal action. It's such a powerful question to ask privately. And I hope someday Indiana will learn why we had 5 or 6 times as many deaths as the state of Victoria in Australia, which has the same population. And so if the county board can tell the governor to start a task like you can't tell him to do it. Anyway, it would be nice if we would learn what happened in the state of Indiana. Thank you.
Thank you for your comments. Thanks. And that's it. All right, you guys, public comment is finished. So our next meeting is December 21st. Oh my goodness, 2 days before Christmas.
Let's say,
Please.
on that issue, is there any chance of moving that up a week? I can make it, but my daughter's in town from school and thanks not to have to come. That day.
I think it just depends on this board. If we can all make that, let me just. Oops.
Time's up.
Time's up. It's all over. I gotta go. Pull out my-
I'd be able to attend the week before.
Okay, I can also. Ellen, that works for you? John,
Yeah.
works for you? Michelle works for you? All right. So then we're gonna go ahead and we're gonna change our next meeting to December 14th at 4:30 in this room.
Who made the motion?
Oh, right, we need
This-
a motion.
It might be a little tough to get you the health officer's report, a week before.
Oh, right, that would be a consideration.
We'll do it. We'll get your health officer's report, but it might not be quite as, we try to get it out at Thursday, right?
Oh, yeah, that's right.
Before.
Again, I can make it. I just,
John made it, I second it. We're good.
Okay.
but
We all said yes.
it's a problem. We can stick with the 21st.
We can do it
Officer's
as long as
report
you
by
all don't
Monday?
mind getting it on.
Say Monday instead of Thursday.
We'll try on Thursday. We'll do our best, but it's a little tough.
And if
for
it
all
needs-
of
If it's a
And I
little
think
late,
what we're saying is if it's a little late, if it comes to us on Monday, we understand because we're changing the date.
Okay.
That just means we need to review it a little later, right? All right.
yeah, so we're gonna move to change it. Do we have to vote?
I did.
Already,
Okay, okay.
already got it all.
So it's
Okay.
fine. Okay.
All right, you guys, we are adjourned. Thanks, everybody. Appreciate it.
It's not even fully dark yet.
Well, here. Oh.
Safety board.
All right, see you, Jason. Bye, everyone.